Good evening. Can everyone hear me?
Yes.
Good evening, honorable members of council, Chief of Staff Tanny Washington, City Council Chief of Staff Daniel Walker, department heads, and members of the public. We are here this evening for budget hearings for Human Resources Department. But first, I would like to recognize the members of the Finance Committee who are in attendance by doing a roll call. Vice Chair Harley.
Present.
Councilwoman Oliver from the 3rd District. All right. Council Member Field, 8th District.
Present.
And at-large Council Member Spadola.
Present.
At-large Council Member Walsh.
Here.
Council President Congo.
Here.
Okay. This time I'd like to recognize the other council members in attendance by doing a roll call. 1st District Council Member Gray.
Present.
2nd District Council Member Darby.
Present.
5th District Council Member Fields. 6th District Council Member McCoy.
Here.
At-large Council Member Cabrera.
Present.
At-large Council Member Dixon. All right, and final call, Councilmember Oliver. All right.
Councilmember Gita Fields is here.
Okay. Thank you. All right, this time I would also like to recognize Robert Greco, Director of Office of Management and Budget, Daniel Owens from OMB Office as well, Human Resources Director Charlotte Barnes, Bruno Battaglia from Human Resources, Wendy Stanford from HR, James Robb, Danny Smith, and if there's someone else, please forgive me for not acknowledging you, but I know there's a whole HR team. And with me, of course, here is Council Strategy Director Michelle Bass-Knight. We do have some other panelists as well, and members of the public who have joined us this evening. Before I turn it over to Mr. Owens for a budget overview summary of the HR department, I'd like to first inform everyone that public comments will be asked at the end of each department's budget hearing, and then we look forward to participation from the public. Public comment is limited to 3 minutes. If there are any follow-up information that's necessary that comes up during these hearings, please either let me or Ms. Marshall Bass-Knight know, and we will track and follow up on these requests. I ask that if my colleagues have any questions, as always, please use the raise hand feature. And now at this time, Mr. Owens, I will turn it over to you for the financial overview of the Human Resources Fiscal Year 22 proposed budget, followed then by an overview from HR Director Ms. Charlotte Barnes, and then there will be a question and answer portion by council. The floor is yours, Mr. Owens.
Thanks for having me again, and good afternoon again, Chairman Johnson, President Congo, and other honorable members of City Council for joining us this evening. Funding for the Human Resources Department. Can you go to the next slide, please? Maybe. There we go. Funding for the Human Resources Department is derived from the general fund and 3 self-insurance funds: risk management, workers' compensation, and health and welfare. The Department of Human Resources is requesting a total budget of $31.99 million. $3 million is allocated towards personal services, $5.5 million is allocated towards MS&E, and $23.4 million is allocated towards the self-insurance account groups, which includes the city's medical costs. Overall, the Human Resources General Fund request is about $2.26 million. This represents an increase of nearly $87,000 or 4% above FY 2021. Personal services remained relatively flat and increased only $2,800 or 0.2%. MS&E costs in the general fund are budgeted at $397,000 and are up $76,000 or 23.6% from FY 2021. A $41,000 reduction in miscellaneous charges that are not otherwise classified is more than offset by a $100,000 increase in consultant costs. Can you go to the next slide, please? And one more slide. Thanks. Moving on to the self-insurance funds. The three self-insurance funds make up much of the total budget request, totaling over $29.7 million, a decrease of $345,000 or 1.1%. Here on this, as you'll see on the slide, in the risk management fund, personal services in the fund remained flat and decreased $139 or 0.1%. MS&E costs in the risk management fund decreased over $310,000 or 7.7%. An increase of $135,000 in liability was more than offset by a $450,000 or 40.5% decrease in insurance claims for legal defense. Can you jump ahead 2 more slides, please? Moving on to the workers' compensation fund. The workers' compensation fund request is $5.2 million. This is an increase of $219,000 or 4.4%. Can you go to the next slide, please? MS&E costs remained relatively flat in the fund and increased $3,300 or 0.3%. The workers' compensation self-insurance account lines collectively increased $148,000 or 4.3%. From figures provided by the city's actuary, workers' compensation indemnity costs increased $360,000 or 23.9%, while medical costs decreased $189,000 or 14.5%. Can you go to the next slide, please? And finally, moving on to the Health and Welfare Fund, which is responsible for the city's healthcare costs. The Health and Welfare Fund request is nearly $20.6 million, which is actually a 1.2% decrease. You go to the next slide again for me? Thanks. Personal services decreased $7,700 or 1.9%, while MS&E costs increased nearly $9,000 or 8.8%. The fund's self-insurance account lines are responsible for paying the city's medical, prescription, dental, and vision costs. These account lines collectively decreased $275,000 or 1.4%. Based on estimates provided by USI, the city's insurance broker, medical costs and prescription costs are collectively budgeted at $16.3 million and remain unchanged from FY 2021. The only substantial change in the self-insurance account lines is in medical stop-loss insurance, which due to the attachment point of the plan decreased nearly $293,000 or 22%. This concludes my presentation of the 2022 proposed budget requests for the Human Resources Department. I can answer any questions you have at this time. Thank you.
This time, I don't believe there's any questions for you, Mr. Owens, so we'll let you know if we have any questions. So at this time, I would like to turn it over to HR Director Barnes, if you have a brief opening statement.
Good afternoon, President Congo, Chairman Johnson, honorable members of council and staff. Thank you for the opportunity to present the fiscal 22 proposed budget for the Department of Human Resources for your consideration. It is my privilege and honor to serve the city as the Director of Human Resources. And yes, I am so excited to lead the department during these very unprecedented times. When I was before you last year, the COVID-19 global pandemic was in its infancy. Who knew at that time that more than 13 months later, not only the city, but the entire world would still be grappling with the lingering effects of the coronavirus? COVID-19 has had a tremendous impact on the entire operations of the department, as HR has and continues to be on the front lines assisting with and executing the city's response. From the medical dispensary, who's responsible for identifying and tracking those employees who've been exposed to, tested positive, or required to quarantine, to the compliance division, who's responsible for managing and tracking various COVID-19 related leaves provided for under the FFCRA and CARES Act, to our class and comp division, responsible for assisting with tracking overtime and other compensation related to COVID-19 costs, and our benefits division, working to assist employees with the increased use of telemedicine. Our entire department has been focused on responding to and supporting the needs of our employees. The pandemic shifted the fiscal year 21 priorities of the department, and much of what we wanted to accomplish, for example, the launching of City University and researching and implementing a new class and comp system, were delayed. However, the number 22 has a special place in my heart, so I believe that fiscal year 22 will afford the opportunity for us to accomplish those stalled projects and more. In addition to the top 3 priorities listed in the presentation, the department will obviously focus on the transition back to the office post-pandemic. The world has changed, and for sure, we cannot just flip the switch and go back to business as usual. We must prepare for a new normal, which includes preparing our workforce for the same. This may include, but is not limited to, retooling our department and division directors on how to maintain productivity and ensure peak performance while managing a virtual or hybrid workforce. It will also likely include enhancing the digital acumen of our workforce, as these times certainly demand it. We will, however, remain nimble and responsive to changes in the environment, while also working to continue the forward progress we've made in the areas of compliance, training, risk control, and healthcare. Resource limitations will hinder, but not deter our efforts. Before delving into the presentation and questions, I'd like to take this opportunity to once again recognize the Human Resources Department's management team. They are Wendy Stanford, who serves as the Director of Employment Services; Bruno Battaglia, he's the Occupational Health and Safety Program Manager; James Robb, he is the Risk Manager; and Donnie Bougely Smith, who is the Employee Benefits Manager. I owe a debt of gratitude to them, along with the rest of the dedicated employees of the department who work hard every day to meet the needs of the city's workforce. With your permission, I'd like to begin responding to council's questions.
All right. Thank you very much for that pretty comprehensive overview, Director Barnes. First off, I guess Councilmember Oliver, you have a question or comment?
Thank you, Mr. Chair. Now, I'd just like to start off with making a statement to Ms. Charlotte Barnes, HR Director. I'd like to thank you and your staff for the outstanding job that HR has done throughout this COVID-19 pandemic and all of the moving parts that HR has had to deal with. So congratulations, because I know y'all been through a lot with this pandemic and, you know, a lot of people working from home, et cetera. So I know you have been affected the most by being the HR director, and I think y'all have done a tremendous job. So I just like to give credit where credit's due. I'll come back. Thank you.
Thank you so much, Councilwoman Oliver.
And Councilmember Walsh.
Thank you, Mr. Chair. Director Barnes, good afternoon. I wonder if you could simply, because this is just not supposed to be an education of council members as to what's going on, but also the general public. And I get questions, not all the time, but a couple times a year, about what various funds are used for. Could you just give a couple sentence overall of what each of these funds, how it impacts and what it impacts, such as risk management? What does that actually do?
The risk management fund is where we manage all of our insurance costs. So for those things that we have to insure, are our property, our casualty, our automobiles, things of that nature come out of that fund. There also is the legal defense is in that budget for all of the lawsuits that we may need to defend ourselves against. So that most of that comes out of the risk management fund. And it also includes, again, cybersecurity insurance with all of the various insurances that we have. That's in the risk management fund. If I move to the workers'
Excuse me, does this also,
I'm sorry.
Does this also include if one of our sanitation trucks slams into a car?
Yes, ma'am.
So it does affect that one too.
Yes, it
Okay,
does.
thank you.
Okay. If I move on to the workers' compensation fund, that is where we manage the medical dispensary is out of there, and that's where our occupational health and safety programs are run from. So workers' comp, our return to work process, our fitness for duty exams for the public safety, police and fire, our medical screenings, our, again, return to work for occupational health. All of that is under the medical dispensary, and that's from the workers' compensation fund. If we move to our health and welfare fund, that is where our benefits are managed from. It includes our medical benefits, our dental benefits, our vision benefits, our prescription costs. It includes the stop loss coverage that Mr. Owens just spoke of. It also includes funding for some engagement activities and wellness activities that we manage out of the health and welfare fund as well.
Thank you, I appreciate your explanation.
Okay. Thank you.
All right, Councilmember Oliver, I believe you're next.
Yeah, thank you. HR Director, I heard you mention the risk management. I noticed the MSC's risk management, and it has decreased. Do we expect this to be a new low?
You said the MS&E in risk management has decreased?
Yeah, see, it was an increase, a decrease. I was wondering, do we expect that to be a new low, risk management?
Well, the MS&E in risk management often has to deal with the policies that we have. So if we have a reduction in a premium on a policy, that could be a low. Sometimes that fluctuates. The other thing that fluctuates in that line is also the legal defense costs associated with defending particular claims that have been filed against the city. So that's why that would fluctuate.
Thank you.
You're welcome.
And Councilmember Gray.
Thank you, Mr. Chair. The risk management fund, I was referred there for one of my constituents who had bullet holes in their car and homes, but from your description, that isn't appropriate. The risk management fund, does it cover citizens of the city that have incurred some damage due to fighting, gunshots?
Each time a claim is filed and it was appropriate to refer that citizen to our office for that, but an assessment is done regarding whether or not we have liability for those actions. And if we have liability for those actions, we certainly handle them. But if we don't, we will advise the citizen of the same.
Okay, thank you.
You're welcome.
All right, and now let's turn to the question and answer portion. Director Barnes, just first, I want to start with the COVID-19 CARES Act impact, what it was last fiscal year, and what you anticipate in fiscal year 22.
Okay, so the expenses for the CARES Act, as I mentioned in my overview, we've been on the front line. So the general fund costs would be associated with the payroll expenses that were able to be covered for our employees that have been directly involved with the coronavirus. as well as our internal service funds. That's where the medical dispensary is budgeted out of. So that's where you see all of the work that they've done as it relates to COVID-19 as well.
Okay, thank you.
Mhm.
Now, can you explain this, that like the special projects fund, or this is in conjunction with Office of Emergency Management?
Some of it is in conjunction with the Office of Emergency Management. I will tell you that cleaning supplies and sanitation services. So each time an employee has tested positive or the workforce has been impacted, we do a deep cleaning and sanitization of that area that has been impacted. So those costs are funded through that special projects line as well.
Is there a cost, because I know that the city's been, for the past year, we've been having the on-site COVID testing in the city county building. Is that a cost distributed to HR? Or is that coming from the county? Like the cost for the actual test?
That testing is provided by Newcastle County.
Okay, so there's no out-of-pocket cost from the city for that?
No, not that I'm aware of. The county is solely responsible for coming in. They set up, they're typically here. It used to be Tuesday, but they're here every Wednesday now, testing the employees in the workforce. And, you can go up and you get tested and you typically have your results within 24 hours. But no, that's something that's handled by the county.
Okay. Got it. All right, now turning to question 2. Again, this is a standard question about American Rescue Funds. At this time, I'm sure we don't necessarily have all the details, but right now, do you have any inkling of how you can use the funds or how you would plan to use the funds?
To your point, thank you. Not knowing what we'll receive and the appropriate use of such funds. HR is inward facing, and our services are provided for the city of Wilmington. Our external facing services are usually as it relates to individuals applying for positions or things of that nature. If you're going to ask me how I could potentially use funds, if an opportunity presented itself, I could potentially partner with an agency on a workforce development project. As I mentioned in my opening comment, the workforce will need to be retooled. We won't go back to business as usual. And not only if our workforce has to be retooled, obviously the individuals applying for jobs, their skill set and their digital acumen has to be increased as well. So if there was an opportunity to partner with someone to do some work in that regard. But again, this department is inward facing, providing a service, internally to the city. So I'm not quite sure that funds would be available for that purpose.
Thank you for that clarification.
Mm-hmm.
Moving on to question number 3, can you, similar to what the council member Walsh talked about earlier, this is a process that not everyone, especially new council members, know about, but can you explain the biennial employee appeals process, the impact on this year's fiscal year 22 budget, and just generally, if you could just give a brief overview of even what it is. I think some council members may not know exactly what that process is.
Sure. Thank you for the opportunity. City Code Section 40-86 provides an opportunity for employees to appeal their classification within our classification and compensation system. That process is an employee initiated process that occurs in September of every even numbered year. So on September 1, they're provided with the documents, and I have conducted, since I've been in this role, I have conducted workshops with the workforce on what the appeals process is, what we're looking for, and how they could potentially be successful if it's warranted. The distinction between that process and someone getting an upgrade to their position during the budget process. The only difference in those two processes is who initiates the process. So the city code provides for the employees an opportunity to do it. And then during the budget process, obviously the departmental leadership can do the same thing. Quite honestly, in a perfect world, the departmental leadership would see or know or be reorganizing their department and recognize a need that someone is working outside of their classification and they may need to be upgraded. In a perfect world, that's how it would always happen. However, there is a provision in city code that if for some reason department managers just don't realize or aren't aware that someone is working outside of their classification, the city code provides that stopgap and allows employees to do it every other year.
All right, thank you.
Okay, and so
can you just explain the I guess this year's budget and what it looked like?
well, there's no budget for the process.
I mean this year, the impact. Sorry.
the fiscal impact. So this year, there were 58 requests covering 93 positions. So when you apply for an upgrade, I mean, when you appeal your job classification, it could be for you as an individual, or if there is a group of individuals that all have the same position, they can apply as a group. So, you know, I can be a staff accountant and there are several staff accountants and we either apply individually or apply as a group. So there were 58 requests covering 93 positions. 25 of them were approved. 33 of them were, I don't like to use the term denied, but 33 did not meet eligibility to be upgraded. And the fiscal impact of those 58, of those 25 approvals, salary and benefits totaled $125,000.
Okay. All right. Now, can you then go? There's no questions on 3. I would like to turn to 4. Can you discuss the city's collective bargaining agreements? I would like to know the terms and also the impact on the budget. Can you go through each one?
Absolutely. Thank you, Mr. Chairman. The city's workforce is 75%. 75% of the workforce is covered by a collective bargaining agreement. So 75% of our workforce is unionized. We have 6 collective bargaining units. We have the International Association of Firefighters, Local 1590. We have the American Federation of State, County, and Municipal Employees, Local 1102. Those are clerical, technical, and supervisory employees. And I'll call what is affectionately known as our, air quotes, white collar union. We have AFSCME Local 1102B, that is our crossing guards union. We have FOP Lodge 1, rank and file. That includes police officers up to the rank of lieutenant. And then we have FOP Lodge 1 for our captain and inspectors. That is a small bargaining unit that includes the 7 captains and 2 inspectors. And then we have AFSCME Local 320, which is our labor, trades, and craftsmen, which is affectionately known as our blue collar union. So the contract terms are listed for each of those unions. 4 of those unions are currently under contract. The contract that is expiring the soonest is the FOP rank and file, which expires June 30th of 2021. I see a typo on the slide, my apology. The Local 320, their contract expired in 2018. We are currently in mediation for that contract. And captains and inspectors, their contract expired in June 30th of 2020. And we are currently in mediation for that expired contract as well.
All right, thank you. There's no questions on the CBA contracts. I then would like to turn to question number 5. Can you discuss the number of vacant positions citywide per department?
Sure. Currently, as of today, there are 101 vacant positions in the city of Wilmington. And the chart there lists the positions that are vacant per department. I would share with you that 70% of the vacant positions are between 2 departments. that would be Public Works and the Police Department. But if you turn to the Police Department, 16 of those 38 vacant positions are police officers who have either left or retired since we've hired a last academy. And it's my understanding that during the chief's hearing, he shared with you the number of police officers that was vacant, and there's a number that he needs to get to before he comes to you and asks, to start another class. So 16 of those 38 are police officers. 9 are crossing guards. In this pandemic, with school being virtual for the vast part of the time, we were not hiring the vacant crossing guards. There was no need to hire them for a position that we weren't even had use of at that time. And there were 3 of these positions were deleted in this fiscal 22 budget. So while they show up currently on the fiscal 21 vacancy report, they were deleted and will be deleted going forward should the budget as presented be adopted. If I turn to the 32 positions in the Public Works Department, 12 of those positions are posted. We are either certifying applicants, interviewing applicants, or offers have been extended for those positions. One of the positions in finance was deleted. One of the positions in parks was deleted. One of the positions in fire was deleted, and one of the positions in planning was deleted. So while 101 seems like a lot to be vacant this time, there is a number of positions, number of reasons for that.
So Director Barnes, thank you very much for the overview. And I want to get clarification. Maybe Chief of Staff Washington can assist. The other day, a previous budget hearing, it was said that there's a hiring freeze. So is there official hiring freeze? When was it implemented? Because I don't believe me or anyone on council knew about a hiring freeze. So what's the status of that?
Yeah, the hiring freeze was actually implemented last year. Basically, we instituted this really early on in the FY21 budget process. And as a result, any position that becomes vacant, the director comes to me for approval when they feel the need to fill that position. We discuss whether it's really warranted at this time, and the decision goes from there. But there is a hiring freeze underway right now. Okay, so it was in place last year. Okay. Yeah. Mm-hmm. And so, so the positions that were just filled, that Director Barnes talked about, yes, those were critical need jobs that we had to fill. Okay. Now going forward, I mean, I guess we don't know. We don't have a crystal ball. I guess for the first part of fiscal year 2022, you still expect the hiring freeze to be in place? I do. Yes, I do. You're right. We don't have a crystal ball. We don't know how what our revenues are going to look like by the end of the fiscal year. So, we will likely determine that at the end of FY21. Okay. Now I got it. Councilmember Gray.
Thank you, Mr. Chair. If we have a freezing hiring, I think when we were going over the constituent services, they were getting 3 new positions, and another councilwoman and I really thought that they weren't doing the type of work and the job that we thought was necessary. So is there an explanation why they're getting 3 positions added and someone like L&I can't get any more positions and they have a vacancy? I'm sorry, constituent services falls under the mayor's office, and they're not getting 3 new positions. There was no personnel change in constituent services. Was it the 311 number, or they're the same? 311 is that's an offshoot of constituent services, but it was no new positions added for that either. Oh, thank you. I was mistaken.
Councilmember Walsh.
Yes, I just want to throw an opinion in here, but I think the other thing we have to be careful of is, are we going to hire somebody for a position that they're going from day one be sitting at home like they don't even know the position yet, that they're going to be working from home. And I think that's also part of why there's a freeze in some of these departments. That, we can't be hiring people that way unless they're absolutely needed at this point. That's just my opinion.
Thank you. Yeah. No, we take those things into consideration. We did establish during this, the pandemic, work from home policy. And, there are a number of individuals that continue to work from home, but they have the capacity to complete much needed work. But basically the positions that I've been approving for the most part have been those in public works and sanitation, the general laborers for the most part. Those are the ones that I've been hiring, that I've been approving.
Thank you very much for that overview. Nothing else on 5. Let's move on to question 6. Director Barnes, can you discuss the amount of city temporary workers, and can you give a breakdown per department?
So I guess I would answer the question this way, Chairman Johnson. The city's temporary needs fluctuates on a daily basis and is often cyclical. So the city temps that the city hires that are directly engaged from the city, that would include our summer youth workforce. So as you can imagine, that fluctuates, and our role is to hire and support the department in hiring those individuals, but we don't necessarily know the needs of the department, and they're responsible for hiring their temps. So on any given day, like as of today, right now, there's 251 temporary employees across city departments. However, I would caution, because some departments aren't as timely as they should be in submitting termination documents. So we could still have someone listed as being an employee in the system, but they are no longer with us because the summer season is gone or something of that nature. So right now we have 251 employees across the city as temporary employees. I contrast that with employees that are hired through a temporary agency. And even though the contract for the temporary agency is let from this department, we don't have responsibility for budgeting each individual's department's number of temporary employees that they would use through the temporary agency. I can tell you that integrity staffing across all departments, the temporary agencies line across all departments, across all funds throughout the city is $1.75 million.
I believe Council Member Darby has a question.
Yes, I do. Thank you, Chair. So of the 251 temporary employees, what department is this like evenly, like where is this mainly where our temp employees are?
Before I answer that question, Councilmember Darby, I do want to congratulate you on your recent award. I haven't seen you to be able to congratulate you, but congratulations. That said, the 251 employees, primarily when we have temporary employees, city hired temps, they're primarily in the Parks and Recreation Department.
May I follow up, Chair?
Yes, please.
Yes, and so when you say temporary employees, are they, some of them are through the city and some of them are through the agency?
So yes, I'm making the distinction. The 251 employees that we currently have listed right now are city temps. City of Wilmington hired temps as opposed to agency temps.
How many agency temps do we have?
That's the number that I'm not going to be able to share with you, because the HR department does not engage with the integrity staffing to hire public works temps or finance temps or real estate and housing temps. We're responsible for issuing the RFP for the contract, but each individual department engages with them and establishes a PO to say, I need X number of temporary employees, whether they be parks, public works, finance, you name it, whichever department.
Oh, I got it. And in regards to using integrity staffing, what was that decision made? And do you know if integrity staffing, are they at least $15 minimum wage? How are they paying people? Are they like, what type of staffing agency are they?
They are, we issued an RFP and we govern what we pay the employees that work through the temporary agency. So that's something that we have in our budget, that we need a person and we're willing to pay this person X. The temporary agency has a 30% markup on whatever we're paying, whatever hourly rate we pay the individual. The temporary agency has a 30% markup. That agency has to abide by all of our rules in terms of who we can hire. We have to approve those individuals to be hired, but they're just the sourcing agency because there is a provision in city code that prevents employees, temporary employees, from working with the city in excess of a certain number of hours in excess of in a given year. So we have to send them to the agency because of that city code provision.
Question I have, do we have like a minimum wage here for the HR department? Like when people are hired, are they at least getting a salary or hourly wage that's equal to 15 or higher?
So I'll answer the question this way, Councilmember Darby. The salaries for, I just mentioned that our workforce is 75% unionized. Their salaries are negotiated as a part of their union contract. So the AFSCME Local 320, which is our blue collar union, which I think their pay scale is the probably one of the junior pay scales with the city. There is, I believe, one position on their pay scale that the first step pays less than $15 an hour, if I'm not mistaken. But we're in the middle of negotiating that contract. And their wages, even if I wanted to today say, we're going to pay you $15 an hour, I cannot do that because it has to be negotiated with the union.
Okay, thank you.
You're so welcome.
All right. Moving on to question number 7, Director Barnes. This is these next set of questions are pertaining to general fund.
Okay.
One of the broken out funds. Can you discuss the current vacant positions, and this is HR, the vacant positions in HR, can you specify the timeframes for filling?
Sure. So there's 7 vacant positions in the HR department. One is currently posted. I have authority right now to fill 2 of those positions, 2 of the 7 that are listed there. So what you have in terms of timeline to fill is an estimate, assuming that the chief of staff would provide approval. The Deputy Director of Human Resources, I'm not sure that many of you are aware, but my previous deputy, Tara DeRocco-Bryan, left us on March 19th. I am pleased to announce that that position has been filled and my new deputy will start on Monday, April 26th, 2021. She is no stranger to city government. Taylor West of the Law Department will be the new Deputy Director for Human Resources.
Thank you very much, and I just wanted to applaud.
Okay.
Applaud
She may be joining us virtually.
On the council side, we can all virtually applaud. So thank you for sharing that. That's always it's great to learn good news and somebody we know and frankly have dealt with on many levels. So thank you very much for sharing it with us.
You're welcome.
Okay. All right.
Yeah. Our human resources administrator, that position is posted. And we are in the process of hoping to fill that position very soon. That's one that's already have approval for. The remaining ones will be filled as approved by the Chief of Staff. One that several are high priority, but one that is a significant priority is our occupational health nurse. We have had some recent retirements. COVID has done a lot of things and it's prompted retirements for a lot of people. Our occupational health nurse did retire back in February. We'll talk about that a little bit more when we get to the health and welfare budget, one of your questions around temporary salaries. What we did with that position was to try to explore whether we would, again, hire a full-time occupational health nurse or whether we would try to do it on a contract basis. The division manager has learned over the past several months that we will, in fact, need to hire an occupational health nurse. And we will be taking that $65,000 out of the budget because we intend to keep the occupational health nurse position. But the positions you see there, as I say, the note is subject to the approval of the Chief of Staff.
Thank you. Now, moving on to question number 8. You described the planned use of approximately $120,000 for professional fees.
Chairman Johnson, I'm going to turn it over to Wendy Stanford, Director of Employment Services, and she'll start, and then I'll pick up the rear.
Okay. So for the $50,000 from Employment Services, it will be used for City University. City University is a learning platform to create learning opportunities for our employees to train, get career development and policy updates as needed. It will be $50,000 so that we can consult and get the platform up and running. So the $50,000 for consultative services to start the platform. And then there's $5,000 for residency investigations and $1,200 for temporary agencies.
I'll pick up. There's approximately $14,000 for arbitration fees. Those arbitration fees are when we have grievances from the various collective bargaining units that proceed to arbitration. There are fees associated with that. And then the $50,000 is to do the research and implementation of a new class and comp system. As you heard in my opening statement, that those things were to be in the fiscal 21 budget, and we had to forego some things, obviously, from the pandemic. But we intend to redouble our efforts and get these sorely needed projects underway.
A question came off the top of my head, Director Barnes. Why is the residency investigation count line only $5,000? I mean, what has it been previously?
Residency investigations, we typically budget $5. I don't ever recall budgeting much more than that, maybe 10. The residency that money is for when the board approves of surveillance for those employees that are not a complaint has been filed against, that there needs to be an investigation into their residency.
And I'm just going to throw it out there. That's not many surveillances. $5,000. I mean, and I'm just going to throw it out there. It's come up on the council. It's come up many occasions. Residency is a huge problem in the city, especially in the police and fire departments. I mean, is there any thoughts about increasing this budget, or historically, have we thought about increasing? Because $5,000 doesn't get you very far. I mean, I know private investigators that, they charge a few hundred an hour. That's only a few hours.
So the last couple of investigations that we did have, we were able to meet our budget. Every residency complaint does not result in the use of surveillance. So we require them to submit the documents that substantiate their residency. A hearing will go before the board, but not every residency complaint results in the use of surveillance. So you could have 10 complaints and maybe just one only needs to be surveilled. So the money doesn't necessarily equate to the number of violations that you may have out there. But
so if we wanted to beef this up, if council chose this as a priority, is that something that HR department could prioritize?
Well,
increase surveillance, increasing.
So let me explain that HR is staff to the Residency Review Board. We don't control the Residency Review Board, okay? That is a board that is a combination of internal and external individuals. There's two private citizens are on the board, and there's a representative from each collective bargaining unit on the board. But HR does not control the board. We are governed by the board, and if they refer something to be surveilled, that's what we do. If there's a complaint, I file the complaint with the board, it's researched, and they make the decision. So it wouldn't be a concern that HR wants it to be a priority. I'm guided by the need for an investigation and the direction from the board.
And so this is, I've talked to my colleagues about this. I mean, at some point this spring, I would like a residency review board presentation at Finance Committee. We may actually meld with Public Safety because this is something that this Council 108 takes seriously, I know. Okay. Sharing the sentiments of many colleagues of mine, because we all know many same employees who don't live where they're supposed to live, including officers, law enforcement officers that don't, and nothing happens. We've seen it time and time again. So, we would like to see kind of an ending to this or an improvement, because I know it might not be HR department's fault, but it happens. We all know people that do it, and it needs to not be happening,
No, thank you so much. No, I appreciate and receive your commentary. I will allow I will make sure that the chair of the board is aware, and we'll go from there.
Which is me.
Which is the chief of staff.
It could be, we have budget, maybe it could be June, but it's something I think a very important issue to the lifeblood of the city. Again, live where you work. We're trying to promote that, and there's a lot of this individuals who continue to flout the system. They say they live where they don't. So
yeah. I think it warrants.
It's so obvious.
Yeah, it warrants a discussion, but to Charlotte's point, the $5,000 is really driven based on the board's decision to surveil someone. This would be instance if we ran out of surveillance money. This is when I would go into the contingency to make sure that we had the needed resources to do that.
And maybe the fix isn't, again, more money for the investigation, but a more beefed up review board or us changing the process of how to increase looking into what's going on.
Okay.
I believe Councilmember Gray, the floor is yours.
Thank you, Mr. Chair. I'm going back to the $50,000 training platform. I'd like to know, is that going to benefit all of city employees or just HR?
No, it's a citywide platform, Councilmember Gray. Thank you for the question.
Thank you very much.
All right, Councilmember Oliver.
Yeah, Chair, you didn't see my hand up when HR Director, I mentioned Taylor. I put my hand up. I just wanted to congratulate. Can you hear me?
Yes, everyone can hear you.
Okay, no, I just wanted to congratulate Taylor. It was a pleasure working with her in her past position. I look forward to working with her in her new position. That's all.
Thank you. All right. There's nothing else on 8. Oh, actually, can you share the information about City University? I don't know if you touched on that yet.
Yes, I'll reiterate what the Director of Employment Services said. City University is a learning platform that will provide some career pathing and training and development for current city employees, helping them to prepare for future jobs in the city's workforce, and will also be some policy training with City University. That $50,000 is to develop this consult to bring that platform to the city.
Okay, thank you. Now moving on to question 9, he discussed, B, I guess, sorry, Director Barnes, just to kind of backtrack a little bit. Do we have a time frame for the implementation of the new classification and compensation system?
Well, we would need to consult with a vendor. Once this is approved, we would consult with the vendor, and then we would develop the platform. You know, we would use their consulting services and develop the platform. It is the goal, quite honestly, to have, once we hire our classification and compensation, director of classification and compensation, that would be the task that they would be initially tasked with. You know, identify a vendor, consult with the vendor, make some recommendations, and then identify the platform. So if I had to attach a timeline to it, I would say fiscal year 2022, Q3.
Okay, and will it have any union implications?
There would not be union implications for a classification and compensation system because any compensation with the unions has to be negotiated.
Okay. All right, thank you. Now let's move to question number 9. Director Barnes, can you discuss approximately $151,000 budgeted across the various account lines, memberships and registrations, food trophies, awards, and travel?
Okay, so the let's start with memberships and registrations. It's and the amounts, as you see listed in the chart, are budget across various divisions within the department. A significant chunk of that is in the employment services division. $50,000 is budgeted for citywide training for the city's workforce. So that ranges from supervisory training to regulatory mandated training. You know, this is the year where we have to train our workforce yet again for sexual harassment. So that $50,000 is for citywide training, whether it be technology training, soft skills training. That's citywide training for the workforce, okay? And that's, you know, 1/3 of the amount that's listed there. The food trophies and awards, which is another significant chunk, that is for our employee engagement as well as our employee recognition programs. We do recognize years of service for employees in the workforce. And we do have a key success program to recognize outstanding achievements within the workforce. So the food trophies and awards are budgeted in those lines. The travel that you see there, and it's listed in, is professional development. That's travel, any travel associated with professional development. So any HR director worth their salt promotes professional development for not only the workforce, but very specifically their individual employees have to stay on the cutting edge of things. A perfect example is all of the knowledge and that we had to gain as it related to the coronavirus, as well as all of the rules and regs that are coming from DOE and EEOC as it relates to guidance on how to implement those things. I provide for every employee in the HR department. They have money in the budget for professional development, and that's what you see there.
All right, Councilmember Darby, the floor is yours. Councilmember Darby.
Yes, thank you, Chair. I have a specific question in regards to, is there anywhere, I don't know if it will be in this part of the budget, but if there's anywhere in the budget in regards to assessing the work environment here for city employees. I don't know, like an annual survey or something that kind of assesses the work environment here in the city of Wilmington.
Let me pull that thread just a little bit more. Can you talk to me a little bit more about what you mean in terms of assessing the work environment?
Yeah, so some work environments can be toxic, negative, and unhealthy, right? And I think it's really important that we assess that, and assessing that by collecting information and data from the actual people who work in that company or throughout the whole city, and assessing how they feel, what they know, what they would like to see, how they're feeling currently, to kind of gauge and assess the work environment in the city of Wilmington.
Okay. So it sounds like you're talking about like employee surveys and things of that nature. So that would be done, the work of the staff would handle that. So it wouldn't necessarily need to be a special line item within the budget, because that work could be done by the staff. Very recently, we did some surveying around the work from home policy, and we just sent that out as like a survey to the employees and got, quite honestly, pretty good results back. So surveying and things of that nature, you wouldn't need to see a line in the budget, because that's the work of the staff here that could do that.
Okay, thank you. Can I request to get information like that? And then could we, I don't know, this might be a conversation, it might not be a budget line, but just looking at how do we make sure that's something that's annually happen, and actually taking suggestions from city employees and implementing it to make it a better work environment here.
Well, we actually do encourage, it's probably not used as much, and perhaps there's ways that we can advertise it more, but there are suggestion boxes, and feedback is solicited from employees. In fact, many of our employees have received the Keys to Success recognition because they have recommended processes that have improved efficiencies of operations for the city. Regarding the work environment, I would be a little concerned about it being a toxic work environment or unhealthy work environment, because that's also not a, those are environments that could cause the city to be in trouble. And every employee upon hire is made aware of the harassment-free work environment, and every person signs that they receive a copy of that environment. There is an individual on my staff that receives all workplace complaints and investigates. There's a prompt, thorough investigation of all workplace complaints. So I'd be interested in having a conversation offline, and welcome that if you desire to have a conversation with me about it.
Yes, yes.
Okay.
All right, thank you very much, Director Barnes. And actually the last part is just explanation of the tuition reimbursement program.
I absolutely totally overlooked that that question, but I can tell you that we typically, that's a program that's not utilized as much as we would like it to be. There, we budget $10,000 each year, and that's based on the experience. I know that in this current fiscal year with the COVID, we've only had 3 people that have requested funding. We do give $1,000 per request. And last year, I can get that for you. I do apologize, but I think it was 7 employees that took advantage of that last year. But I can get those numbers for you and submit them to Marshall.
All right, thank you.
I do apologize.
No problem, no problem. I know it's a lot to cover, so we're here with you. Oh, and also just the verbs of training, with the emergence of, just a quick follow-up, is it with the emergence of cultural issues, cultural competency being a vital part of organizations, is there a cultural competency component now to training, training about interacting with African American and Hispanic and communities of color? Is there like that kind of training program that's being worked on?
Being worked on, I'm not going to say this being worked on, because right now a good bit of our focus has been COVID-19, quite frankly. We will be ramping up to do a number of different things as we transition back to the workforce. What I will share with you is this. One of the things I've tried to do with our department here is make sure that we have employees that have the professional certifications that require them to stay abreast of changes in the industry and cutting edge and different trends in the industry. And 5 members of my team have professional HR certifications. So that field and that information is not foreign to us. It's just with all that's going on, how do we find the time to bring that to the workforce as well? All of our trainings will have a component of making sure that we're meeting the diverse needs of the workforce though.
Gotcha. Thank you. Let's move on to question number 10, Director Barnes. Can you discuss the planned use of approximately $96,000 budget for miscellaneous services, specifically pertaining to ADP payroll services?
Wendy Stanford will respond to that question.
Okay, so the $96,000 for ADP is for operational efficiencies. That was the driving purpose of migrating to an external vendor. The annual estimated cost savings is $135,000.
Okay. So my understanding, I guess we're going to continue to use ADP for the time being. Is that the plan, Ms. Stanford?
Yeah, there's no need to migrate away. We are still in the process of moving in that direction, but there's no need to migrate away from it.
All right, thank you. And finishing up with general fund, can we turn to question number 11? Can you discuss any new technology requests?
Certainly, that question will be handled by the employee benefits manager.
Hi, good evening. The Health and Welfare Fund made a request for a new benefit enrollment software that will be used for our employees and our retirees for all of their enrollment, terminations, and family status changes. The software allows for an improved user experience, increased communication, and certainly better data accuracy as it pertains to Munis and how the healthcare information is processed and received by the vendors, meaning our healthcare vendors. The vendor we selected for the software is Winston Benefits. They got their start with working with public sector clients such as the city, and they also were selected due to their ability to function and connect with the Munis system that we have. And our plan for implementation is this coming August.
Thank you very much, Ms. Smith. Now moving on, I believe now we've reached the Internal Services Fund section. And I believe that takes us to question number 12. Can you discuss the approximately $20 million budget for employee healthcare costs? And can you also make sure to delve into the preventative measures that the city takes to help promote good health, especially during these times?
Sure. So overall, what I have in this chart here for you today is a summary of our major medical line, our major healthcare programs. And the overall story is that due to COVID, our medical broker has advised us to keep our medical and prescription flat. Other lines where you see a $0 difference has to do with rate holds, contractual rate holds that keep our rates at the same level going into FY22. So the main driver here is that we have seen, it was interesting, we took our dental program to self-insured versus being fully insured a year ago. And we were better able to get an assessment of our dental costs and claims. And so we saw that while people were actually going to the dentist quite a bit despite the pandemic, it's still, the self-insurance claim number is still lower than we were 2 years ago on our fully insured dental program. But the real driver in terms of the decrease is our medical stop loss. And stop loss is a gap insurance where it helps us to manage potentially catastrophic claims. And so based on our medical trend, we feel comfortable moving that attachment point, which is currently at $200,000 to $250,000, which therefore reduces the overall annual premium by $292,000. So that's where you're getting that approximate $270,000 to $75,000 decrease in the fund.
Okay, gotcha. Ms. Smith or Director Barnes, can you explain kind of measures that your department's taken to promote good health among city employees?
Absolutely. There's a few slides. The next, Donnie, let me do an intro.
Yeah.
The next few slides that Donnie will walk through will take you on a number, will give you some backdrop to where we've been, where we're going, and we speak very specifically to your question around wellness initiatives, because there's a great story to tell there. Donnie?
Thank you. So back in April of 2017, there was a healthcare task force report that was published. And within that report, it made several recommendations that had both a health and a financial outcome based on our implementation. So we have been hard at work implementing the recommendations. And the things to always remember with healthcare is that it takes 18 to 24 months, maybe sometimes longer, to really see the impact of the plan design changes, the wellness programs and such. So nationally, what this chart is actually showing is that nationally, healthcare costs increased by 8% year over year. And so you can see, if you look at the second year, in 2017, the city had a really sharp increase in our healthcare costs, taking us far even above the national average. We went to work, we got very busy, and by improving our plan design, managing site of care, data accuracy, increased employee engagement and accountability, you can see that we've been year over year able to decrease the overall cost of healthcare, and that we are now well below, we are a good percentage below the national average. And that's really what you want to see. And we call that, bending the curve in healthcare. And this chart really shows that we've been able to do that in the last few years. So if you were to just even take our medical line alone, which is right now sitting at $13.4 million, if we had been on the path we had been back in 2017, that medical alone would be the total fund. It would actually be at $19 million. Rest everything else yet. So it really is a good story, because we have been able to not only implement these recommendations, but we also have done that while at the same time expanding the benefits portfolio. So, 2 years ago, we didn't even have a fully fledged vision insurance and things like that. So as we've completed, for the most part, the healthcare task force report, if we could go to the next slide, we have now recommissioned ourselves and rededicated ourselves to a new 3-year strategic plan. We've been well at work in terms of starting that process for our year 1 plan. And I just wanted to take a moment to share with you the mission statement that is our guiding force as we move forward through the pandemic. The City of Wilmington strives to have a modernized benefits portfolio for our employees, retirees, and their families. Our 3-year plan achieves this by continuing to stabilize healthcare costs, expanding our offerings to include virtual care at all levels, improving our back-end administration, developing advanced wellness events and programming, and maintaining a high standard for data accuracy and privacy. Our ultimate goal is a thorough, caring, and truly expansive benefits program that allows all to live long and to live well. So I wanted to just share that with you, just to let you know, kind of as we were moving forward, directionally where we wanted to go. And if we go to the next slide, I can share with you about the preventative measures that we've been through and where we're going. So I've shown this word cloud before, but just to give you a sense of the culture of wellness and accountability and engagement that we've tried to create here. So you can see that, we've rolled out our physician engagement program, which is our WellWorks. I mentioned the fully fledged vision program that didn't exist. We've been able to expand our dental plan to include a new 3rd, richer plan. We've done a lot of work. We've started to do some work with diabetes prevention. Our signature event is our Fall Fest, which is really a kickoff to our wellness education activity. And I would say too that, we started last year doing doing our national, the National Pre-Diabetic Prevention Program on site. And so, really, when I think about it, it feels like COVID slowed us down, but it didn't stop us. And so we're excited for our new FY21 and FY22 programming. So under the teledoc umbrella, I will be coming back to council to amend that to now include not only general medicine, but teletherapy. I mentioned our diabetes prevention program, which we'll start to do for round 2 and round 3. The CDC actually has come back to us and asked us to be a pilot employer for a healthy heart initiative that's focused on high blood pressure. We have planned workshops regarding weight management. Not so fun fact to share. I found out through a conference that in the last year, the average adult has gained 2.1 pounds each month of the pandemic. So the COVID-30 is real, and we are determined to have programs in place to help our employees. So you'll see that roll out, especially as we get into open enrollment. We want to have much more of a education focus rather than information. We do have, yes.
I don't want to throw you off course, but actually that brings up a great question. And I know it wasn't maybe kind of a loaded question, but what is the thought about what does HR plan to do about education regarding vaccines? I know certain organizations are trying to promote it. Obviously, the CDC recommends it, but is there a plan, or at least a beginning stage of planning, of at least education and awareness, and that possibly employees that get it maybe will enjoy certain benefits or privileges that other unvaccinated employees don't. I know it's fraught with a lot of issues, but what is the thought? Because we have to get back to business eventually, and I think lack of education on the vaccine, I think, may hold our city back.
So I'll take that, Chairman Johnson. We are working now to determine if we can get a feel for the number of our employees that have been vaccinated. We were able to work with St. Francis through a program, and we offered it to several of our non-public safety yet essential employees. And we even extended that to council. You'll remember that we sent out something asking, council members if they wanted to be vaccinated. While the vaccine is still in emergency use, it cannot be mandated. Public employers cannot mandate its use. So we can make people aware, and we've been driving our employees, giving them information around where they can be vaccinated. We have provided opportunities for all public safety employees and essential employees to be vaccinated. And we've encouraged employees to get vaccinated, where they can. We also did a PSA on the vaccine process and encouraging people to get vaccinated. And that was done in both English and Spanish, encouraging not only the workforce, but the population, the Wilmington population, to get vaccinated. You're absolutely right. We at some point have to get back to what will be a new normal, but I did want to make it clear that as a public employer, we cannot mandate the vaccine, and we will be guided by the CDC as well as the EEOC around guidelines for what we can and cannot do for employees who do not desire to be vaccinated.
Okay, thank you. Councilmember Cabrera.
I just want to say that I was part of that public service announcement. I thought that was a great idea to bring in community leaders, trusted people in the community, so folks can see our faces and see that we're encouraging them to get vaccinated. And those are the things that we can continue to do. Thank you for including me, and thank you for being proactive on that. Truly appreciate that, and for all the work that the personnel department is doing and has had to do through these trying times.
Thank you so much, Councilwoman, and thank you for your service.
Really
And And I feel left out. I have not seen it yet, but thank you very much,
I'll send it
Councilmember.
to you.
And again, it's about education. There's hesitancy there for a reason. So my thing is, you know, we need to break down the walls, and the city government group, however we can assist, and even connecting people with doctors of color that may have a better rapport with. That'll be helpful.
Yeah, you know, sorry.
No, you can go.
Well, I wanted to add, you know, so because we're a self-funded employer, we actually had to make the decision whether COVID testing would be free, whether the vaccine would be free. And at all cases, we've always opted to add that and to make that amendment to our plans. And so that COVID testing has always been free for our employees. And actually, you know, should you choose to administer the vaccine, should you choose to receive the vaccine, you would have a zero share as an employee for receiving that. So that is something that we've incorporated into our plan design, so that there would be no barrier, there'd be at least no financial barrier to wanting either a test or an actual shot.
Okay, Councilmember Darby.
Yes, I'm not sure if my question, it doesn't go with preventative measures, but I had a question in regards to health. I am interested in seeing HR stance on including in their budget to extend family paid leave. Currently, it does not matches the state for 12 weeks. And expanding it how they're doing. It's a family paid leave movement going on now, where it's extended family paid leave outside of just having a baby, but including adoption or to take care of a loved one. But really looking at, if we were talking about preventative measures, we're talking about having a healthy employees. Have we looked at family paid leave in regards to being able to stay home with their baby and not have to worry about to survive or to adopt or to stay home with a loved one?
So I'll take that, Donnie. Yes, the city does have a paid parental leave program. We offer up to the first 4 calendar weeks to the birth or adoption of a child. The adoption of the child can be 5 or under. We, like I said, we offer up to the first 4 calendar weeks without use of your personal accrued leave. So there is 4 weeks, depending upon the shift that you work. There is potentially 4 weeks of paid leave. We do, you know, obviously we allow the leave off indefinitely in support of the FMLA as required, but the paid portion is the first 4 calendar weeks, and it is for birth or adoption of a child, and it's for both parents. It's not only for the female. It's parental leave.
Yeah, I'm sorry. Can I follow up?
Yes, please.
Yes, I was asking if I'm familiar with the current 4 weeks that you offer, and I know specifically just my experience having 4 weeks is not enough time after you have a baby. I'm not sure about adoption. I can't speak to that, but I had children. And 4 weeks is not enough. And the state has 12 weeks. I was wondering if you guys are open to extending the amount of time that someone has with their baby. Your checkup is at 6 weeks with the doctor after you have a baby. So trying to see if the department would be open to extending family paid leave.
Okay, I won't speak for the mayor's office as it relates to that, only because there was a cost associated with that. When we implemented the 4 weeks, there was a cost, and not only a cost, because obviously you want to make sure that you have that time for family bonding, but there's an operational impact for offering the 12 weeks. We absolutely offer 12 weeks because that's what the FMLA requires. So you can get 12 weeks. It's just that the first 4 weeks, you don't have to use your time. If somebody had a baby and wanted to stay out the whole 12 weeks, we would be obligated to let them stay out the whole 12 weeks. We would just only be guaranteeing them that they would be paid and not use sick or vacation for the first 4 weeks.
Yes, yeah. So I just think it's a conversation probably outside of this to have, because I know the 12 weeks is mandatory, but I'm talking about 12 paid weeks like the state does. So I think that's a conversation to have.
Absolutely.
Council Member Fields.
Yes, thank you, Council Chair. Director Barnes, I just have a really quick question. So when, and again, this it doesn't have anything to do with the preventative care, which I think is awesome. But my question to you is, when a person has to go out for short-term disability or for like that family leave or adoptive leave, do they have to pay into a short-term disability fund? You know what I mean? Like, do they have to, pay into it to where it's like you might give them, the city might offer 66 2/3, but then do they have to pay into something to get it at like 77% of their pay? Or is it at 100%, or does it depends on the amount of years of service that they have for the city?
So I'll try to, there was a couple of questions there and I'll try to answer it this way. If you're speaking about the leave associated with the birth or adoption of a child, the first 4 weeks is paid at your full salary.
Okay.
And it is not required that you use any of your sick or vacation time. Anything beyond those 4 weeks, you are required to use your sick or vacation time that you have available. And if you have sick or vacation time, it's paid at the 100% level. In recent years, the city has offered the ability for employees to purchase volunteer supplemental insurance, i.e. short-term disability insurance. Until recently, we didn't offer that. And one would ask why. The city's sick leave benefits are so rich. You get a day a month, every month, and you can accumulate up to 240 days. So because you can accumulate so much sick leave, the city traditionally had not had short-term disability insurance because your sick leave was your short-term disability insurance. However, in recent years, we have offered the employees the opportunity to purchase when they do their open enrollment, which will take place in May. We offer people the opportunity to purchase supplemental voluntary short-term disability. The benefits of that program, it could be 66 2/3. I'm not as familiar with what that program offers because I don't have it. We just offer the employee the opportunity to purchase it. Does that answer your question?
Yeah, it does. So can I follow up one more question, Chair?
Yes, please.
Okay. So do you offer and I might have missed it, so please forgive me if I did. My apologies. AFLAC?
Well, it's not AFLAC, but it's similar to AFLAC. It's the AFLAC brand. It's the AFLAC type of insurance. So it's not through AFLAC, but it's the AFLAC type of insurance.
Okay, and part-time employees privy to that?
Part-time employees are not. If you consider council part-time, council members absolutely are, but a limited service employee is not.
Okay. I think that's it. Yeah, because y'all gonna have us busy come May anyway. Hi, Mark. Anyway. Thank you.
The Health and Welfare Fund administers or offers the voluntary short-term disability insurance, but we don't actually manage the policy or the determination of how leave. So that is within the city's compliance division that handles anything as it pertains to all kinds of leave. So we're not a total rewards function. I don't handle FMLA. I don't handle, my division doesn't handle leave of any sense. We're just focused on employer and employee paid benefits.
Thank you.
Thank you for clearing that up. And with the healthcare, just kind of wrapping up on this, can you look at, kind of macro globally? Can we look at how Wilmington's healthcare costs compare to other cities?
Sure.
Cities size?
Yeah, that's the next slide. So it's really difficult to compare us as an employer. Not all organizations do not offer the same healthcare. They don't have the same negotiated contracts or the same plan design. I can share that as a self-funded employer, we enjoy highly customized plans. And I did do some research, and from an employee share perspective, we offer at our highest a 12% share for our negotiating unions and non-union staff. There is an incentive to get a discount to 10%. But nationally, in the public sector, employees pay 15% for single coverage and 30% for family coverage. Family coverage is defined as 2 or more people on a plan. We offer the same, 12% for all 3 tiers. And that information came from the US Department of Labor in statistics that they published last September.
Okay. Thank you. Moving on to question number 13. Can you discuss the $3.4 million budget for self-insurance costs in the workers' comp fund?
Yes, I believe I'm going to handle that down here. The 3.4 million is actually based on an actuarial study, and you'll see the figures are in front of us. With this actuarial study, it just gives us an overall of 3.4 million of what's going to be expended. We took it upon ourselves to make sure we could account for our GL lines and where the money is coming out. This is obviously an educated estimate of where the costs are coming. When you look at the overall cost, though, it's not really a $360,000 rise in indemnity. It's actually $131,000 total on the workers' comp line. And I guess the question is, where is the driving force? Well, I think with workers' comp, and Mr. Johnson, you're probably aware of this, in your profession, there's several driving costs. It's not just one. Obviously, the escalating medical expenses. Right now, we're in a more litigious environment. Every year, we've got to deal with a workers' comp rate increase. And then we recently had some long-term total partial disability claims that have come in that we're going to be looking at probably for the next 300 weeks. And as we had an aging workforce, we had some that go off, and that's where those costs are rising. But it's across the board. It's not just indemnity, it's medical. I mean, it's across the whole board. We did put some money into indemnity because we saw that's where the money was being used the last year or two.
Thank you very much. Any questions from council? Not. Thank you very much for the very, very good overview of the workers' comp program. I believe now we can turn to question 14. Can you discuss the $4 million budget for the insurance claims line? And that's just Mr. Battaglia or Mr. Rob. I'm not sure whose question this is.
It's Mr. Rob.
Sounds like he can't.
I'll take it while he's trying to get.
Oh, wait, there it is. There it is. My mic was muted.
No
Am
problem.
I back?
Yes, the floor is yours, Mr. Rob.
Okay, thank you. Sorry about that delay. The insurance coverages on this slide before you there show the city insurance for damage to our property, as well as coverages for liability claims, which includes cyber claims, which we haven't had any, fortunately. Funds are also budgeted for outside legal defense and for risk control to try to reduce the costs. And then under workers' compensation, you'll see the $400,000 for the excess coverage. That's for catastrophic cases. Just in the event we should, God forbid, have a very large loss that we don't take a huge financial hit for that. So if there are no questions, we can go to the next slide.
Mr. Rob, is that the traveler's insurance policy?
Are you talking about the excess coverage for no, that's workers' comp is Safety National.
Okay, Safety Nationals, the carrier.
Yeah,
Okay.
the travelers is up under liability, 52402.
Got it.
The total claims you see there are shown on the next slide, including a projection for fiscal 22 in the different categories: workers' comp, automobile, general liability, and property. So no questions. The next slide addresses the next question. The breakdown of claims by department is shown on this slide from fiscal 20 right on through fiscal 21 and the year to date. Any questions on that? All right, next slide. Legal defense by outside counsel is only in complex and very specialized matters. It's really required in those areas. It's beyond the capabilities of our law department, as you can understand, Chairman Johnson, as a lawyer yourself. There have been several cases in the last year where those services have brought settlements or dismissals of matters that could have cost the city multi-millions that were either dismissed and the dismissal was upheld on appeal, or else we were able to reach a settlement. For 14C, the city does carry.
I have a question, actually, Mr. Rob.
Yes.
So the legal defense, I know through the years, more litigation has gone to outside counsel. Is that trend going to continue? Versus it used to be more in-house?
I don't believe that's accurate. You'll see quite a reduction. I believe it's in the neighborhood of 400,000 this year in the legal defense budget, 450,000 reduction in the fiscal 22 budget. So they use the outside counsel sparingly. When they're needed, they're essential. I don't see them, from my perspective as the risk manager, I don't see them farming cases out, so to speak, willy-nilly. When they do, it's because it's a really significant case or a really complex case. So no, I wouldn't say the trend is to increase the use of outside counsel at all. As a matter of fact, for the employment claims, they're keeping most of those in-house. They've brought in some employment claims type lawyers, and very few of those are sent to outside counsel now.
Thank you. And I believe, get you on subsection C.
Yes, I mentioned the city does carry cyber insurance with really substantial limits. I don't want to give specifics, but we have a very comprehensive cyber insurance policy and cyber insurance program with incident response plans, et cetera, that are orchestrated in coordination with the IT department. And then for 14D, fortunately, in the last 2 years, there haven't been any matters in excess of the insurance retention or deductible, whatever you want to call it. But several matters are pending or were resolved that could well have or could still result in millions in costs to the city if it were not for this coverage. Like the medical stop loss coverage that Donnie was discussing and other the excess workers' comp. I mean, the idea is to pay a reasonable amount for excess insurance so that you don't have to keep tens of millions in reserves in the event of an occasional claim, every 10 or 20 years. You carry the insurance and you hope you don't have to use it. That's the idea of insurance, really.
All right, Councilmember Gray.
Thank you, Mr. Chair. I have several questions. One, isn't the city self-insured, or are we self-insured for certain departments and not for others? And the other question I want to know, has the suit been settled, specifically the suits by the deceased, the family of the deceased firewoman, and the suit with the mayor and the treasurer? Have those suits been settled or resolved?
I'll defer that second question with respect, Councilwoman Gray, to the law department that I understand you're speaking to next. With respect to whether we're self-insured, yes, we are. We're not self-insured for property. We have a deductible for property. If the city county building burned down or something, we certainly don't carry money to cover that. We pay with a deductible for that. For liability, we're self-insured up to a certain point, in the hundreds of thousands, above which we have liability insurance with travelers. So things like automobile accidents, which thank you for referring your constituents to us, and we have set up the ability for them to send texts as well at your request. We cover those in our self-insurance. We don't even need insurance for that because the state law has a $300,000 cap for automobile and that type of cases. So we're totally self-insured for that sort of thing. But when it comes to federal cases, civil rights cases and that sort of thing, that's what we carry the insurance for. Otherwise, we are self-insured.
Follow up, Mr. Chair.
Yes, please.
Does that include the Parks Department, Parks and Recreation?
What aspect, ma'am?
Damages to equipment, park
equipment?
Yes.
If their equipment is damaged through the actions of someone else, what we would call a casualty loss, the risk management fund pays for that, and then we subrogate, go after whoever caused the damage. But we cover the repair of the equipment or replacement of the equipment as necessary.
For natural disasters too? I mean, as in storms?
For natural disasters, yes. Not all property would be covered, but most property of the city would be covered by our general property insurance, commercial property insurance. Yes, ma'am.
Thank you.
Welcome.
Okay, thank you very much, Mr. Rob.
Welcome.
Further questions on 14, I would like to move over to question 15. Can you discuss approximately $929,000 budget for professional fees?
I'll take this one, Mr. Chair. The next chart you'll see is list all of the various vendors that we have for professional fees. And they range from our dispensary doctor to the vendor that we use for our fitness for duty exams, for the medical diagnostics for that, our actuary, our liability and our insurance broker and our health benefits broker, the vendor that we use for physician engagement and telemedicine and the upcoming teletherapy, the vendor that we use for our background checks, and also the vendor that we use for the various cybersecurity initiatives. All of those total the $900 some odd thousand. There is one vendor that is a DBE.
Thank you very much, Director. Moving on to question 16, can you discuss the planned use of approximately $155,000 in temp salaries? This is a $65,000 increase over last year.
Sure. So the $65,000, I mentioned it early on, that will be reduced in our budget. That increase was because we were trying to determine whether we were going to use a contract employee or whether we were going to keep our full-time equivalent. We put both in the budget. We've since made the decision that we're going to go with hiring an employee versus the contract employee. So that $65,000 will come out. And once that comes out, our budget for year over year is flat.
Discuss, turning to question number 17, Director, can you discuss or justify the approximately $75,000 for membership registration travel?
Sure. So as I mentioned earlier, every employee in the department has, and this will be the next slide. every employee in the department has professional development that they would be eligible for. So the membership registration and travel, a good bit of that would be for the recertifications or the training and professional development for the employees. But roundly 35,000 of that is for our wellness programming as well.
So with the, I didn't ask it earlier, but with the travel and these registrations, is there expected that later this year traveling is going to resume? Because I guess it's safe to assume that nobody's attending any conferences now, correct?
Well, this budget starts July 1 and goes till next June 30th. So it is anticipated that things will open back up and there will be conferences that people will be attending. There's a conference that was postponed for the spring that I was on the planning committee for, the National Planning Committee for, and it was delayed from last spring. It was supposed to happen this spring and it's been delayed until this fall. And it is an in-person conference at this point. So the thought is that things will open up. And again, this traveling goes through the end of the next year. The other thing I've noted in terms of professional development, that while some conferences may be virtual, they are charging you more for the virtual conference than they were if you were doing an in-person conference. So whatever we thought we could save on travel, these registration fees are turning out to be more than if you were doing an in-person conference.
Got it. All right, thank you very much, Director Barnes. No questions on 17. Everyone can view the organizational chart of HR department. Any comments or anything about the organizational structure that you would like to comment on?
No, just that it's 26 employees, 3 of which are appointed. I already announced the appointment of the deputy. We spanned 6 divisions. It's 26 employees, and we're thankful that we can service the citizens of Wilmington as well as the workforce. And I thank you for the opportunity to present the fiscal 22 budget to council for your consideration.
All right, and at this time, Director Barnes, this time I would like to turn it to the public to see if there's any comments from members of the public. All right. Seeing none, I then would like to turn it back to members of council if there's any final questions or comments. All right. Seeing none, I would like to turn it to you, Director Barnes, if you have any final closing comments.
No final comments, just thank you for your consideration. I look forward to engaging with each of you as you desire. I know Councilmember Darby had some follow-up questions, and I believe someone else, Councilmember Fields, Brigida Fields, had some questions as well. I'm available and look forward to hearing from you. And also, if there's any follow-up questions for me, I'll engage with Marshall to take care of them as well.
All right. Well, thank you very much, Director Barnes.
Thank you.
I look forward to working with you through this budget, and again, good luck and to your team out there as they're on the front lines trying to get the city through the pandemic. So we really appreciate the work that they do.
Thank you so much.
Thank you.
Well, with that, I would like to the HR department's budget hearing has concluded. At this time, we're running just a few minutes behind schedule, but we're close to schedule. I would like to take a few-minute break and begin law department at precisely 7:15, where the city attorney Goff and his team will present their budget.